Hello, I'm Juliet Chastney, Project Manager for the LiSHoRe project. Welcome to this webinar, Diversity, Spirituality and Leadership. It's great to have you today. If you would like to quickly say hello in the question and answer section and say where you're from while I'm speaking, that would be great. This is the final in a series of 6 webinars on topics relating to spirituality and religion as experienced by ethnically diverse NHS staff during the COVID-19 pandemic. These webinars are part of the LiSHoRe project, which is a study funded by NHS England, and we have been conducting consultation groups with ethnically diverse NHS staff up and down the country to explore their experiences and guide us towards the topics for these webinars. How today's event will work is our speakers will have a discussion with each other for the first 30 minutes or so. Then we will open up to questions and answers. Everyone attending this webinar has their camera turned off and their microphone on mute. If you would like to ask a question of our speakers, please type into the Q&A section and they will be moderated by Ria, who you will see more of later. Please type your questions in as soon as you think of them while we're still talking, as there is a delay before we can respond. All of these webinars are being recorded and will be available on our webpage later. Our speaker for today is Charmaine De Souza, who's Chief People Officer at Oxford Health NHS Trust. Charmaine has worked across a range of organisations in the public sector, including the BBC and Civil Service, where she was HR Director at Her Majesty's Revenue and Customs and worked at the Cabinet Office on senior leadership talent. Charmaine then had a 4-year tenure as HR Director at Greater London Authority, the capital's unique devolved governance body, which supports the Mayor of London and London Assembly. Whilst there, she led on the design and delivery of the Mayor's flagship talent programme for women across the GLA group, Our Time, which encourages the progression of women into senior leadership roles to support the ambition to reduce the gender pay gap. Charmaine is currently a voluntary board member at Hightown Housing, which is a charitable housing association serving the home counties. While career and work remain an important part of her life, she's also come to appreciate the importance of balance and making room for things that give her joy. She is recently taking up painting and loves sketching, drawing and keeping fit. She has 1 teenage son and lives in Hertfordshire. Thank you for being with us today, Charmaine. Joining her in conversation is Reverend Dr. Guy Harrison, Director of the Oxford Centre for Spirituality and Wellbeing and Project Lead for the LiSHoRe project. Over to you, Guy and Charmaine.
Thank you very much, Juliet, and I would want to wish to add my welcome to you, Charmaine. It's great to have you with us. Really pleased to have you as our final speaker in this series of webinars. And I wonder whether I might just start us off by asking you, or at least referring to our consultation groups who were telling us a little bit about the impact on themselves of bringing them the whole of themselves and finding this really very difficult, including their religious and their spiritual selves, which they regarded to be very, very important, but actually how to bring oneself into the workplace and the power and the impact that that can have on colleagues, on the organisation. I wonder, from your own perspective, as a person I know of faith too, what would you like to say? Could you say a little bit about that and the impact of bringing the whole of oneself and how difficult that might well be?
Well, thank you for the introduction, Juliet. Thank you, Guy, for opening the questions. So I think you probably would have heard and read that I've worked in a number of different places across my career. I think they've all been different in terms of the types of professions that you might get in the workplace, the work that they do. They were mostly all public sector, or entirely public sector actually. But even in the public sector, there are different, I guess, flavours of public sector. And when I look back over my career, I think it's quite different when you compare, for example, the civil service with maybe the culture at City Hall, and then again here in health, which has a different culture in relation to how people conduct themselves at work, the values that they hold. And then I suppose central to all of these roles, and particularly when I was promoted to the senior civil service, which was about 7-8 years ago actually, when I became HR director at Revenue and Customs, I think I really understood and learnt the importance of bringing your whole self to work. Now that was partly self-realization on my part, but I can't take full credit for that. So maybe I'll talk about how that came about. So I had been, it was quite a sort of turning point, and I'd been working Department for Education, which is quite a small polity department, and I got this promotion and ended up in a very large national non-ministerial organisation, where I was effectively HR director to a really huge directorate. There were about 26,000 staff, 160 locations, so just part of HMRC. And I sort of didn't really understood that when you become a senior leader, there are lots of people watching what you do, looking to see how you act, what you speak about, what you don't speak about, watching how you interact with your colleagues. And I was stopped in a corridor actually we were based in London at Parliament, just opposite Parliament Square. And a person I didn't know came up to me and said, it's amazing to have you in such a senior role. It makes such a difference. You won't, I hope you understand that. And that never really happened in the Department for Education. It just wasn't that type of place really. And I realised, of course, what she was saying was that it was about who I was, that I was a person of colour, that I was a woman, and I was in this senior role. And I guess I started then to think about this long shadow that we all cast, because it goes well beyond our immediate people that we speak to in an organisation. And then separately to that, Revenue and Customs at the time was doing a big exercise on staff engagement, and it put all of its senior leaders through a programme to practice basically telling stories, and the power of storytelling, and also the power of being open about oneself in the workplace. And my boss happened to be the executive director champion for faith, and he is a practicing Christian, so was I, and I think I saw what he did in that realm, and how we celebrated a whole range of different faiths in the workplace. And I think that was the turning point for me in I guess thinking about how open I am about my faith, and how I bring that into the workplace. And more importantly, I think that I was bringing my whole self to work. And that biography that Juliet wrote out, I'm not sure I would have written a biography like that 7-8 years ago, but as time has gone on, I realised that you have to give a 360-degree view of who you are, and that I have the ups and downs of, I share the ups and downs of parenting, I share the ups and downs of somebody who maybe realises work-life balance is important, that keeping fit is important, and people can bring a much richer picture to yourself. And so I do talk about all of those things and my faith, and I have just taken on the executive director championing role for spirituality and religion here in Oxford Health, which I've just started my journey on.
Thank you, Charmaine. And I think I'm sure you're absolutely right about the power of story, being able to tell one's story and have the freedom and the confidence to be able to do that, and to know that you've been listened to. I think that's one of the big challenges, isn't it? Or at least certainly in terms of our consultation, that was one of the challenges many of our ethnically diverse staff were saying to us, and how we celebrate our faith, how we celebrate the whole of ourselves, and bring it within reason, I guess, in terms of into our workplace. But as a senior leader now in the NHS, how do you think we could facilitate a greater openness and a greater awareness and a greater understanding of the place of one's own spirituality, personal spirituality, one's faith, one's belief? It's great that you're with Oxford Health championing the equality group of, as you say, of religion and spirituality. But how do you think as a senior leader we might be able to do that, or how you might sort of help us to do that in some way as well?
Yeah, thanks, Guy. So I think it's I don't know if this is going to answer the question, so please do say. I think we all have agency to take action at different levels, and at a senior level, it's about, in the organisations maybe that somebody might work in, it's about getting this on the agenda and getting it debated. It's not that long ago that the issues of, say, gender or LGBT rights weren't really debated in organisations, and given the profile that they should have in terms of equality. The Equality Act itself is not that old, is it really, when we think about it? And so I guess it's about us finding the right forums, finding the right people to connect with. I personally believe in the power of staff voice and the importance of having staff networks in place. When I arrived at City Hall, we had very few in place, and I, as a senior leader, ran some lunchtime sessions just to energise and show that we had commitment behind them, and we got in place a wellbeing network and a carers network. I never quite got to the interfaith one though. Managed to get a few people interested, but I ran out of time before I had to leave that job. So coming to Oxford Health and finding that we've got a network here, I was very keen to provide support and advocacy. So I guess staff voice and advocacy is really important, is what I'm saying. We all have that. And then as a senior leader, if you do have those people who are interested in your organisations, then you should really put effort into supporting them, championing them, getting this debate onto board agendas or executive agendas. And then from on an individual perspective, I think I think each individual has to decide at a senior level how much personal information they want to give. I don't think that's something that you can prescribe, and I don't think there's a standard format for it. And sometimes that's your own personal faith journey that you go on. So it's about how you find the most meaningful way to give your support to people and to do that. And of course, actions speak louder than words, don't they? So it's about not just what we say, but what we do, I think, as well.
Absolutely. And something about, whilst we certainly do have agency and need to take, I guess, some responsibility, I think for many people, one of the things that they find most difficult, and certainly the evidence from our project, is that actually sometimes people feel misunderstood, or feel that actually they're going, if they were to be able to speak out, and yes, of course, it is a deeply personal thing. One's own spirituality, one's own belief is deeply embedded in who we are as people. So yes, there's that sense in which we need to be cautious, perhaps, or we're respectful of each other's very personal kind of journeys, and we're all on a journey in that sense. And faith is very much part of that. But people were saying they felt sometimes silenced or sometimes ignored. And particularly in the pandemic, when things were so difficult, and it was an extended crisis whereby actually it affected deeply the whole of oneself, and for ethnically diverse staff and people of faith and spirituality felt sometimes that it was just not regarded, or assumptions were sometimes made about their faith. How do we develop? It's a very big question. These are all really challenging questions and take time, but how do we develop a culture that is sensitive and that is curious and that is open to matters of faith and belief and spirituality?
That is a very big question, Guy. Well, where do I begin? Well, I think, well, funnily enough, I had when Guy asked me to and Juliet asked me to speak at this event, I've been thinking about it ever since. Guy did give me a sense of what it could be like, and I kept when I'd gone to church at the end of February, I kept the gospel reading, which happens to be Luke 6, 39 to 45, and I always think it's such a really good reading because it's all about how it's a parable, I guess, about how we never notice the plank in our own eye when we can see the splinter in somebody else. And if there's one thing that I have definitely had to control is, I'm quick to judge other people. So I always think this is a very good reading because it tells us really that we have to refrain from judging others for what they may say or do. But of course, in reverse, we will be judged, won't we? We will be judged by maybe if we reveal, if we disclose, I guess, religion. And for some people, they may think that religion, they'll have preconceptions of the faith that you hold. So whether it's Christian faith or Islam or Judaism, they'll have preconceptions of what that means that potentially, I'm going to just generalize. If you're a practicing Christian, then you might be homophobic. You will be intolerant for those who maybe are trans, that you won't condone certain actions and issues. So I guess people are fearful. That's really what that's about. It's about other people's fear of what that may be. So I always try and position my own faith as one of inclusivity and of not judging. And that's hard to do because, whether it's my faith or others, there are certain tenets in the faith that, that other people will see as being that you are defined by. And I think society particularly has been very shocked by some of the abuses, say, of the Catholic Church. Many church I go to, Catholics, many Catholics have left, and some of those historical abuses continue to make our headlines on the news. Most recently, the way that unmarried mothers were treated, actually all the way right up until the 1970s, which sounds actually not far long ago, and it isn't very long ago. So I guess it's about finding the right place to talk about these things, to maybe think about how you will be heard, and actually, if you speak a message of love, which and tolerance and respect, then hopefully that will mean that you are heard in the right way. But there's of course no guarantee of that, and we don't know the journeys that other people are on, and maybe the very bad experiences they've had from other people. So it's a difficult one. It's such a personal journey, and the situation we all find ourselves in is very personal, I think, as well.
Yes, and in that sense, it points again, doesn't it, to the power of story. We're coming up now to probably the most holy season. Well, I know it is the most holy season in the Christian calendar, and also to that place of a personal challenge, which is Ramadan for someone who's a Muslim. So two very significant periods of time, and I suppose therefore it's about being able to say this is what this means for me, and having that opportunity to do that. And I know our Oxford Health Equality Group is seeking to do that with our diversity lead, Mo Patel. So maybe it is about all those opportunities to be honest and open, and to be curious, and to ask the difficult question, and not therefore make those assumptions. And it's risky, and yeah, how we take those risks, one with another, when we're unsure, and therefore needing to kind of sometimes gently challenge too, gently challenge. So I was aware that certainly looking back again at our the feedback from those staff that Juliet and the group interviewed, many staff did perceive that they were indeed in safe and compassionate and spaces where they were able to open up to their problems and be cared for, which is positive. But some people were also saying how the leadership in their trust ignored and excluded the voices of ethnically diverse staff, including on one occasion the voice of a participant who was actually the chair of the Black and Minority Ethnic Network. And it has to be said very sadly that there were a significant number saying that this was a very hierarchical institution that they were working with, which it found it difficult to involve staff, and that was exacerbated by the pandemic. And so that's the kind of the darker side of the story, really. I'm not sure it's a question for you, Charmaine, but I don't know whether you'd like to sort of respond to that, how we develop compassionate leadership, which I guess in some senses can't be taught. It's deeply personal as well.
Yeah, right. I think all organisations have their challenges. By nature of being an organisation, there's usually some sort of hierarchy, unless you're, I don't know what organisation possibly wouldn't. You may be a small business, maybe, but even then there's probably a boss, isn't there, somewhere along the way. So, the NHS trusts are large, complex organisations with people working under significant pressure, taking difficult decisions every day. And so, like all other organisations, so, most of the places I've worked are very big. There are going to be, unfortunately, cultures and subcultures, cultures in locations, cultures in particular teams. I don't think you can necessarily generalise. And certainly I've done a lot of work in terms of diversity and inclusion, and not necessarily just faith, but race and gender. And two things come to mind. I remember in Revd and Customs, and we had a real focus from the top, a really compassionate, inclusive leadership, that there were still pockets of offices where there were really quite bad practices going on. And of course, in a geographically spread organisation, that will happen, because it's difficult to create a single culture when people aren't in a single location necessarily, and other issues get in the way. And then separately, I remember at City Hall, the real intersectionality between faith and sometimes caring responsibilities and gender. So I noticed that when I tried to set up a parents and carers network, there were predominantly women from an ethnic minority background who came to be part of that group. And then interestingly, they all talked about the role that they undertook in their churches. So often they were giving caring responsibility to people not just necessarily in their own families, but through their faith, through a much wider community. But in both of those places, there was really clear leadership about creating safe spaces to speak. And sometimes we got that right, and sometimes we didn't. And in the end, it comes down to that type of leadership. But the one thing that I have always thought is, if the person at the top, whether that's the chief exec or the chair, is role modelling compassionate and inclusive leadership, then that really is a must. It's very difficult to do without that.
Thanks for that. And I think actually also thinking about the NHS, that and there are always challenges. I mean, we have we're working with groups of staff who are often exhausted. The last 2 years has taken its toll. Sometimes morale is low. Resources are challenging. Waiting lists are huge in some places. So there are massive challenges there. And I often think that actually, and I know our own chief executive here at Oxford Health is very keen on this, and I think many people have appreciated the fact that they're simply saying thank you and thank you for all that you do. But I think also developing an appreciative approach, so that actually we may well have problems and challenges, which of course we will and always will, but how we actually, instead of looking at the problems and the difficulties, or looking at particular staff groups where we don't think things are going terribly well, which of course sometimes we need to do, but actually using that sort of point where we generate an appreciative response, and out of that appreciative response, then you look at the challenges and the difficulties and so on. So I'm just in thinking of the time, and there have been a number of questions. I think Rio, would you mind sort of asking some of the questions for us? Would that be all right?
Yeah, that's fine. So we've had some introductions, and then there's a comment here. Thanks, Charmaine. Where people hold different religious or non-religious views, what tips can you give us about making sure that the idea of inclusivity is seen as a genuine and applies to us all in the workplace?
Thanks, Rick. Can you just say that question again? Sorry.
Yeah, of course. So it's where people hold different religious or non-religious views. What tips can you give us about making sure that the idea of inclusivity is seen as genuine and that it applies to everybody in the workplace?
Thanks. Yeah, well, I think most of us can spot if something is a token gesture. I think we can probably sometimes see that or feel it. And so I guess if we want to be serious about this and authentic, we have to actually make inclusion part of the small things and the big things that we do. So those are, I think there might be people here who are in my team. They'll know that I am very I place lots of importance on being really open and transparent about how decisions are taken, about, for example, opportunities in the team to apply for jobs, for being able to give my time and have an open door, virtual or otherwise. So my view is, as much as I can maybe be a sponsor for a staff network, I'll actually probably be judged on the small ways that I interact and how I bring inclusion to the everyday, and how I use my time. And I'm not saying that's easy, but I think if you don't do both, you really don't give a chance for your authentic self to be at work and to be seen at work. So I hope that answers the question, Mia.
Yeah, thank you. Then we have another question, which is from Ginny. It's great discussion. My question is whether you feel more of our NHS colleagues working from home during the pandemic has been helpful in terms of allowing expressions of diversity or spirituality, or has it hidden it? And then there's a follow-up question, which is how can leadership reflect diversity and spirituality when we don't see each other in person?
Yeah, those are really good questions. I can see Ginny's first question there, so thank you, Ginny, for that question. So I think, well, it's been 2 years, hasn't it, this month, that I don't know what it was like for you, but we were, thrust to home and told to log in on some sort of video device to try and work, and it all seems very novel, and 2 years later we're still here. And I think, of course, we lose, you know, it's my personal opinion. I think there are so many benefits for inclusivity for the way that we are maybe now working. So I know of colleagues who have disabilities who talk about the fact their disabilities actually have no longer their barrier for joining meetings. They don't have to travel. They don't have to necessarily worry about maybe the arrangements they need to make, or the fact that they need to have facilities nearby. They're in a safe place and they can interact. And one of my very good friends, who's a diversity consultant, said he's a wheelchair user. He said people don't no longer see the wheelchair, so sometimes he actually has to say on camera, I have a disability, which of course he took for granted when he would do face-to-face work. So the thing that he actually, you know, for him, it's had to make him rethink his identity when he's working online. But to answer Ginny's question, yes, I personally think we lose so much through the minimal face-to-face contact that we've had. We lose the time to have meaningful conversations, to maybe talk about things that are sensitive and difficult. We're less likely to do that, or just to notice somebody in the office, say hello and ask them what they've done at the weekend, at which point they might talk to you about the faith they have, where they've been, and how they've spent their weekend. I sometimes find that we are very regimented in this, so we all join a call for a certain topic, but we didn't lead our lives in offices like that before. We didn't all just sort of go around and switch ourselves on at certain times and off again. But clearly we have to find a balance, and I guess as Guy said earlier, we have a great set of colleagues in Oxford Health, and so we're really going to try and use everything we can and all the technology we have available while many of us are still working remotely, to talk about the religious festivals that people may be celebrating over the next period, whether that's Easter or Eid later in the year. I think that's the order that they're coming in, or other things. So yes, I probably think we have lost something over this period, Ginny, but we're hoping that we can try and replicate it in other forms as best we can.
And then kind of just following on from that, how do we think leadership can reflect diversity and spirituality when we don't see each other in person? So you've already kind of touched on trying to have less regimented screen time, but how else do you think leadership in particular can support?
Well, I think whilst we're all working like this, I think if you're in a position of leadership, which doesn't necessarily have to be, I know the NHS, like lots of public sector, we all have grades, aren't we? And we sort of introduce ourselves by our grades. Very odd thing, because I'm sure in private sector that doesn't happen. But you might have quite a lot of leadership, having just chairing a meeting or convening a meeting. So how you do that, how you give time for people to talk and introduce themselves, how you manage an agenda, how you make sure that people feel included and have the opportunity to share, as difficult as it may be, it's something that I try and place some importance on. You know, there's always you know, under pressure, there's always a temptation to get to business straight away, isn't there? But actually, sort of, how are you? How was your weekend? Ask about people's lives. It's before you start. I think it's about creating that really safe space for people, so that they can open up and share. And I always say to people, don't worry about your kids at home, pets, boys. You know, we're all, you know, we're not in our workplace, we're in our homes, and therefore I think if you say things like that, people are more likely to be more comfortable in this online environment. And as a leader of any sort, you should try and make it a safe space for people to do that.
Yeah. Kind of linked to that, we've had another question, which is from Kay, and they are saying, thank you for this interesting discussion. Do you think part of the issue with genuine inclusivity and respecting, celebrating and understanding diversity is connected with general lack of conversation which are encouraged on these topics. For example, safe, respectful spaces to discuss spirituality across belief systems. It seems a common issue people report for staff, service users, and I think general public as well, even in the media. There's a lack of opportunity for people to openly share, discuss, talk, and listen to people's experiences of spirituality, including from different belief systems.
Yeah, I think that's a really interesting observation. I think it was Kay, wasn't it? Or it could be somebody beginning with the name Kay. Yeah, I mean, gosh, I think I really have a sort of natural curiosity about other faiths and how they celebrate and the meaning behind those faiths and the celebrations they have and the customs and rituals that they may practice. And I guess maybe it comes from your individual mindset, because I think we share much more than we have much more in common than we differ on. But maybe not everyone has that mindset. So I find it fascinating to speak to colleagues of different faiths and to understand that. But yes, I wonder whether, I think maybe the last 2 years has taken away some of those spaces. And I wonder also whether just more secular society has taken away some of those spaces, because we don't necessarily have those in our communities that we live in, so they become more boundaried as a result. I don't think it's an unintended consequence of a number of things, I guess, that come together. But you know, I really try and support it. I remember when my son was in Cubs, it must have been, or Scouts. He's 14, 15 now, so he's left. But they took the troop to see a number of different faith settings and to understand what that meant. And you know, I really support that. I, as a parent, I would do that. And I thought it was quite interesting that they had that on their curriculum. I guess I suppose where I'm going with that is that maybe sometimes that is dependent on who is organising things and how it's run. So I guess we all can show support for that, but in all of our communities, and making sure that we support interfaith and debate and connections. But it isn't easy, and particularly I think because I think as society has got more secular, there's less tolerance for that, I feel. So I think actually Kay did talk about the media. I think she's probably got something there, but or he's got something there, but the media can be intolerant of such issues, and so people are frightened to do that, frightened to disclose, because they're not sure about the implications or the consequences for this.
Yeah.
If I may just put jump in then, if I may, just to simply say that I think also we're thinking about religion and spirituality. In that sense, spirituality has a wider perspective, and so there are of course people who would say, and so often say, oh, I'm very spiritual but I'm not religious. And in that sense, the respectful understanding of a wider concept, which I think in terms of being a chaplain within an NHS organisation, I would want to embrace, because I think there's a lot of possibility in terms of actually kind of engaging and being curious and seeking to understand and develop that the resonances that may well be there. People of no faith and different faiths and of a deeper spirituality, which may be found in all sorts of things like nature or wherever it might be. Well, and I was thinking that next week there is the National Day of Remembrance, 2 years after the pandemic began, remembering all those who have died and all those who are still suffering from long COVID and so on. And we've opened up religious or sanctuaries, we call them in our organisation, for people of all faiths and none to come and be together. In that sense, it's another way of actually encountering one another and simply sitting and being together, rather than necessarily talking very much. Simply just, for some people it will be prayer, for others it may be meditation, for others it's simply just being alongside other colleagues and remembering. So I think there's something there too in terms of understanding diversity and finding those safe and respectful spaces where we can all engage one with another. Ria, is that one more question, I think, is there?
Yeah, there's one more question. I believe it's from Brian. It's, do you believe in leading from the back? If so, when is it most effective when dealing with staff working in the NHS? And if you don't believe in leading from the back, why not? What are the challenges?
I'm afraid, Brian, I don't know what leading from the back is. Is it a phrase that is used in the NHS and has some sort of definition?
Yeah, that's a good question. I mean, yes, I don't recognise that as a kind of leading. I mean, we talk about leading from the front, don't we? But yeah.
So I guess if we take the assumption, I mean, this is just an assumption, but leading from the front would be, I guess, from the top. So maybe a bottom up approach. So ground level, maybe grassroots, probably not the right term. But
yeah,
starting maybe, I guess the lower grades, if it's a grading system.
Yeah, so Brian or BN may clarify through the comments, so we'll wait for that. I think there's a bit of a delay, isn't there, sometimes, so they're probably typing away as we speak. So I'll look out for it if it comes into the question feed. I guess I can only speak, I guess, from my own journey.
Sorry, he means bottom up.
Oh, right, okay, thanks. So I can only speak from my own journey, but I think there's two or three things, isn't there, that we all have agency and we all have voice. And so if it's from the bottom up, yes, of course, you know, I've joined at different points in my career, I've joined different groups, staff groups, to find support, to be able to connect with people, to be able to have a safe space. But equally, I think I've also seen in some of the organisations that I've had to work in, that without that inclusive leadership from the top, it can be a very frustrating place, I think, then, because there's a sort of block, a barrier in the way of getting things done and changing the culture. So I've learned maybe along the way that you need both. You need staff voice as well as clear leadership from the top. And Guy has mentioned our own Chief Executive, Nick Broughton, who here is at Oxford Health, and he is very unequivocal about his support for inclusion and for diversity, and he will show that through his blogs and his video blogs and his written blogs, but also he'll show that by attending our events that we have on inclusion and diversity, where sometimes he doesn't have a speaking part. He's there to show his support and know and realizes that that's really important. So I guess you need both. So I wouldn't say that it's not effective. I just think it's going to be much more effective if you have the leadership that goes with it.
Okay, Ginny's got a follow-up question, which is this the same as servant leadership? Not entirely sure what that means, but
I don't know. I think there probably is a model around servant leadership, but I probably shouldn't try and guess it.
I think there is certainly within the Christian faith tradition, there's a strong sort of element of servant leadership. I have some challenges around the word servant, because I think whilst I think in its positive sense it can be something that is certainly we're in service to our clients, if you like, our patients. That's our raison d'etre. That's what we exist for as an NHS. We're there to support and serve our patients, serve our community, and serve one another. And so that can be really very positive. And I think in that sense, there are possibly similarities. I know there's somebody on the course that I run who is developing their ideas around servant leadership, and she is a senior leader in our organisation. So it has lots of positive connotations. The downside possibly for me is that actually servant leadership can sometimes seem like, or it can be kind of equated to a more subservient, so that we're kind of a lower order, that we have to serve people to the detriment of ourselves, and I think that's where it's problematic. So actually, as long as we are we're affirming the place of our own place within our organisation, and affirming that as a leader and as leaders, then I think that's fine and good. So that would be my observation from that question. Looks like we've got another good question from Katya, but Ria, would you like to introduce that?
So this is apologies that this was Kay, so this was Katya. She says, I used to run educational groups and courses on spirituality and mental health recovery for people across all religious and spiritual beliefs, and I was really surprised how open people were to working together and sharing across different beliefs with little or no friction. In fact, lots of inspiration gained from the conversations. I wonder if there's a bit of a fear myth which sometimes discourages people from seeking out these conversations, and the need to move beyond seeming divisions across beliefs to support connection and understanding. I know certainly in the context of mental health, a great need is often reported in people wanting to talk about and share about their experiences, but a lack of opportunity to do so in a way that is safe and non-judgmental.
So yeah, I think Katya makes a very good point, and I think maybe the success of that group, that the educational group that Katya runs, was because of the tone and the way that it was structured, that it was tolerant and non-judgmental. Maybe that was this part of the success, and I guess that takes skill and thoughtfulness, and it takes somebody who's confident enough to do that, to deal with maybe challenge in that. So I guess it's, how do we give people who've got the who are in positions where they maybe they can bring about such groups, how can we give them the confidence to do this in a way? And as Guy said earlier, it's a really important point that we have to be tolerant of people who are spiritual, who have no faith, but who do want to enter this debate, and in the same way that we're tolerant of everyone. So I guess that's the hard part, isn't it? Because it's difficult to pull off. And I think this is just a personal opinion here, I think so much of today's society also means, I feel I see it, and sometimes I can be, we can jump to intolerance pretty quickly. for social media sort of allows us to like and not like, and I use that, that phraseology, whether it's the Instagram or post or tweet something and like it. Yeah, we are in a world where people can have we sort of encourage to have binary views on something. We agree, we don't agree, when actually sometimes maybe we'll agree to some of it, maybe we'll agree to it today, maybe we think about it, and we maybe we're less sure tomorrow, but we don't live in that. So striking a group where people can sit with that level of maybe ambiguity about how we will have to live our lives and what it means is so important. And I always feel, in everything that I've heard, whether it's mediation events that I've had to run, or outside of work, other events, I always I always think, gosh, when somebody's had the ability to hear and listen and to another person's stories, they generally have a different view, don't they? We can all think we all think we know what it's like for somebody to live their lives, but until we actually place ourselves in their shoes, it's a different feeling that we get. But of course, we don't get that chance until we actually engage in a meaningful way. Well done, Patches, I'd say, for that.
We've had 2 more questions. Well, one's really more of a comment, but it's an interesting one. So psychiatry training used to teach that a person talking about God or praying more, etc., could be a sign of illness rather than seeking support. This influenced me to remain silent about my faith. Then the second question is, has the bulletin ever had any articles on spirituality topics, particularly from different staff groups, to help broaden understanding?
I don't know the answer to the second question. I have been reading the bulletin since I've joined, so I know that we've promoted our religion and spirituality, and I'm pretty sure that we've done some work in the past on stories about people and their faith, but I'm not 100% sure, but I'm sure we could. Certainly in my last organisation, we always profiled somebody as we entered into Ramadan, and we talked about their journey, what it meant to them, and how important it was for their spiritual faith journey. So I can't see why we wouldn't be able to do that here in Oxford Health.
If I may sort of come in there, absolutely yes. And of course, for those who are not Oxford Health, we have a regular bulletin, and I'm sure other trusts do, where we're able to kind of, it's a kind of our main means of communicating one with another in terms of the organisation. But I'm sure that's true. We could do that, and have certainly advertised events from the chaplaincy department. That's for sure. And I take entirely the point that's made by a colleague who's working at the JR, and I think that's right. And I think still, sadly, we do pathologise, and still sometimes, within my experience, and indeed my understanding, my own research suggests that actually our service users tell us that sometimes their praying or their belief in God is not accepted or not understood, or is a direct result of their own psychosis or whatever it might be. So it's a good point, it's a sad point, and I'm very sorry to hear that that actually silenced you, and too often that has been the case. More positively, I think, and I would hope that that is changing and rapidly changing as psychiatry evolves, and as we evolve as a clinical teams, as we work to include people's spirituality and people's faith and belief. But I wonder if we could just pause, conclude there in terms of the questions. Pause by saying, first of all, that a big thank you to Charmaine, and thank you so much for joining us. Really appreciated your time and your insight and your wisdom and your experience from so many years of working in so many different organisations. So thank you so much, Charmaine. But this is also this is the final of 6 webinars we've had as part of the LiSHoRe project. We started way back, I think November, something like October, November. And we had Professor John Swinton as our first person. We had Abdullah Shahzan, Ria, who you've just met again, Ria presented, and Brian, our other consultant on the LiSHoRe project, Brian Yintanga, and Rina Vahora. So it's been a wonderful opportunity to explore in a broad way spirituality and religion, particularly as it's affected ethnically diverse staff across the NHS. And I'm going to hand over now to Juliet to kind of give a little bit of a summary perhaps of that, and also to conclude the session. But thanks again, Charmaine.
Yes, thank you, Guy, and thank you, Charmaine, for your very thoughtful responses to those questions there. That was very helpful. I do have a few things to say, and then, yes, I do have a few concluding remarks, so thank you. This webinar is nearly finishing. We would greatly appreciate any feedback you have about it. Within the next couple of days, we'll email you a link to a very brief anonymous feedback form. And if you have any thoughts you wish to type straight into the Q&A section now, that would also be gratefully received. Thank you. And a reminder that all of these webinars have been recorded, and to access the recordings, either click on the link in the Q&A section or go to the web address appearing on the slide now. And so this is the final webinar in our series, and I've been given the chance to make some concluding remarks, which I take as a great honour. The LiSHoRe project and its exploration into the experiences of ethnically diverse people in the NHS, I believe, has been an important and valuable step forwards in creating a more equal NHS and, in turn, a more equal society. This journey has been very inspiring to me personally, because my partner is Black African British and my children are mixed Black African and white British, and I've seen firsthand the many challenges and sometimes fears that people can face. I worry about my children's future all the time in terms of what additional obstacles they will face in life as a result of their ethnicity, and I found the consultation groups and the webinars and the people I met in them inspiring, with their insight into life in Britain as an ethnically diverse person, and the different ways people have thought about this experience and how they've kept their spirit alive and their hope for the future. I would like to thank the LiSHoRe team, the webinar speakers, the people who have attended these webinars, and all the participants in the consultation groups for their courage, their imagination, and their determination to make the world a better place. Thank you and have a good evening.